Water supply at communities such as Petanenge is inconsistent. There has been an upsurge in cases of the Bilharzia water parasite in the broader area. The hardest hit since the re-emergence of the disease are schools neighboring the Lititele River.
All these villages are actually nearby neighboring villages to Petanenge. So that means that our scope of testing and screening will then increase to look at school children in those areas. But to make our life much easier and also to make the process much simpler, we call on parents and guardians to actually present their children to their nearest healthcare facilities for screening as soon as they see any symptoms or anything that could raise suspicion to the effect that the children could be having bilharzia. Because the school health program might actually take a little bit of time due to resources, but it's easier to get children tested in the nearby facility.
Some desperate residents fetch water from rivers and streams that are contaminated.
We don't have water. It's been a long time. People in Petanenge don't have access to water. Contractors who were hired to fix the pipelines have not fixed the problem. There's a disease that has been discovered from the school. Learners have bilharzia. This prompted the municipality to supply us with water using the tankers. School learners are sick at Malwandla Primary. They said 145 have been affected. They said there is bilharzia. They took more samples and we haven't gotten the results.
Doctors at Letaba Hospital have treated learners who were diagnosed with the condition recently. Some of the common symptoms include abdominal pains and a urinary tract infection.
The organ that is affected the most by this parasite, it's the urinary tract, that is the bladder, the kidney, and that is where you get most of the complications that we see. It varies. It can cause, renal failure, which is the kidney not functioning the way, it should. In long term, it has also been associated with development of cancer of the bladder.
Meanwhile, the Mopani District Municipality has conducted tests in the water source at Malwandla Primary School.
The results from the water samples taken from a bowl at Malwandla Primary School came back as negative, which has been our stance all along, that the disease cannot be from underground water or any of our bulk water supply network.
Communities have been cautioned not to swim in rivers or streams or consume water suspected to be contaminated. Katle Khonyoni, SABC News, Petanenge Village in Limpopo.